ಅನುಭವದ ಕಥೆಗಳು. ನನ್ನ ವಾಹಿನಿಯ ಎಲ್ಲ ವೀಕ್ಷಕ ಬಂಧುಗಳಿಗೆ ನಾನು ರೇಣುಕಾ ಪಾಟೀಲ್ ಸ್ವಾಗತಿಸುತ್ತೇನೆ ಹಾಗೂ ಎಲ್ಲರಿಗೂ ಗೌರಿ ಗಣೇಶ ಹಬ್ಬದ ಹಾರ್ದಿಕ ಶುಭಾಶಯಗಳು. ಮಾನವ ಕುಲವನ್ನೇ ಕಂಗೆಡಿಸಿದ ಸಾಮಾನ್ಯ ಜನರಿಗೆಲ್ಲ ಸಾವಿನ ಭೀತಿಯನ್ನು ಹಚ್ಚಿ ರಣಕೇಕೆ ಹಾಕುತ್ತಿರುವ ಕೊರೋನಾ ಎನ್ನುವ ಮಹಾಮಾರಿ ನಮ್ಮೆಲ್ಲರ ಜೀವಿತಾವಧಿಯಲ್ಲಿ ನಾವು ಕಾಣುತ್ತಿರುವ ಭೀಕರ ಸತ್ಯ. ಇದನ್ನು ಸ್ವಂತ ಎದುರಿಸಿ ಬದುಕಿ ಬಂದಿರುವ ಅನೇಕ ಜನರ ಅನುಭವಗಳನ್ನು ನೀವು ಕೇಳಿರಬಹುದು. ತಮ್ಮ ಜೀವನದ ಹಂಗನ್ನು ತೊರೆದು ಈ ರೋಗದ ವಿರುದ್ಧ ಹೋರಾಡುತ್ತಿರುವ ಡಾಕ್ಟರ್ಗಳು ಮತ್ತು ಇತರ ಆರೋಗ್ಯ ಕಾರ್ಯಕರ್ತರು ನಮಗೆಲ್ಲ ಸಮುದ್ರ ಮಂಥನ ಸಮಯದಲ್ಲಿ ಶಿವನು ವಿಷವನ್ನು ಕುಡಿದು ದೇವತೆಗಳನ್ನು ರಕ್ಷಿಸಿದ ಕತೆ ನೆನಪಿಗೆ ತರುತ್ತಾರೆ. ಇದೇ ರೀತಿಯ ಪ್ರಸಂಗವನ್ನು ಎದುರಿಸಿದ ನನ್ನ ಆಪ್ತರಾದ ಡಾಕ್ಟರ್ ಶಂಕರ್ ಗೌಡ ಪಾಟೀಲ್ ಮತ್ತು ಶ್ರೀಮತಿ ಡಾಕ್ಟರ್ ಯಶಸ್ವಿನಿ ಶಂಕರ್ ಗೌಡ ಪಾಟೀಲ್ ಅವರು ತಮ್ಮ ಅನುಭವಗಳನ್ನು ಇವತ್ತು ನಿಮ್ಮೊಂದಿಗೆ ಹಂಚಿಕೊಳ್ಳುತ್ತಿದ್ದಾರೆ. ಇವರು ದಿವಂಗತ ಜಯಕುಮಾರ್ ಕೋನಿನ್ ಮತ್ತು ನನ್ನಕ್ಕ ಶ್ರೀಮತಿ ಸೋನಾ ಕೋನಿನ್ ಅವರ ಮಗಳು ಮತ್ತು ಅಳಿಯ.
Hello everyone, I am Dr. Shankar Patil, physician practicing in vijaypur. We have our own nursing home called Vijaypur Nursing Home, and
I'm Dr. Ashwini Shankar Patil. I am a pathologist. We have our own laboratory in our hospital.
The reason we wanted to talk to everyone is 25th June I was known to be COVID positive. Because I had seen a suspected corona patient on 22nd of June. The moment we had exposed, we knew that we were going to be symptomatic. Since then we were in isolation, and on 25th June we gave our throat swab for RT-PCR. After few days, few of our staff and including me got symptoms like fever, body ache and chills. We were in isolation. We thought that the ongoing pandemic has affected us, and we started the treatment consulting our friends who were also physicians, and we were in isolation. The confirmed report came after 1 week of testing, and it was positive. And the symptoms were progressive initially, even though I was taking the prescribed tentative treatment for COVID-19. And on July 2nd, the symptoms aggravated, and I had a little amount of cough and slight breathlessness. So on evaluation, my friends were in touch with me. They asked me to get evaluated, few COVID related blood tests, and we got a CT thorax done, and the CT scan was showing bilateral nodular opacities in the basal areas of both the lungs. So my friends told me to get admitted and get treated early. So on their advice, I went to my friend's hospital at Gowda, that is MV Patil Hospital. His name is Dr. Patil. He is a surgeon by profession, but he manages everything. So he was prepared to treat COVID patients. So that is the reason I thought I'll go and get treated at his hospital. I stayed at Gowda in his hospital for about 10 to 15 days. I was treated according to the protocol and evaluated. Few of my friends, Santosh, Praveen and Umesh also were guiding and evaluating my treatment and progress. And
they were constantly in touch via the video calls and
with the available treatment, I was very lucky to get recovered, and I recovered very fast. And after 15 days I got my throat swab tested, and it was confirmed to be negative, and I was discharged from the hospital on 16th of July 2020. Then I returned home to my family and kids whom I was away for almost 3 weeks since I was exposed to that suspected COVID patient on June 22nd. It was a very tough time for me, staying in isolation, getting infected, and staying away from family and kids. I have two beautiful kids. One is Neeraj, who is 10 years old, and the other is Harshita, who is 5 years old, and my beloved wife. We all had a very tough time, but family, friends, all were together with us, and we could come out of this dreaded disease and also the stressful condition. What I want to stress upon here is, though this appears more scary, I think we are not supposed to be scared of. Early evaluation, getting treated is what is going to help in preventing the complications as well as recovering faster. My message to general public is, you should not get panic. This is a pandemic, ongoing pandemic. One or the other person, today or tomorrow, everyone is going to be affected. So few are the protocols which you are supposed to follow to stay away from the disease and the infection. First thing is, if we have symptoms, we have to report early and get evaluated. You're not supposed to hesitate. And
We're not supposed to hide the symptoms from others.
Sit in fear. You are not supposed to panic. Treatment is available, though it was in infant stage earlier. Now the pathogenesis, how the disease progresses and what are the complications, everything is defined, and there are specific drugs for each complications or the pathogenesis. So with the available treatment, most of the patients are recovering and doing well. Then apart from treatment, we are supposed to maintain hygiene. Good hand hygiene is what is important. Then stay in social distancing, which is also very important in decreasing the spread of the disease. And one important thing is, we are supposed to stay away from elderly and kids as much as or if possible, because we will be transmitting the disease to the elderly and the kids which will be staying at home. And disease in elderly is going to be much more complicated.
Lastly, we want to stress on one point. Kindly stay home, stay safe, leave home only when it's absolutely necessary. Otherwise, kindly be at home and be safe. Thank you.
ಇದೇ ರೀತಿ ನಮ್ಮ ಆತ್ಮೀಯ ಗೆಳೆಯರಾದ ಡಾಕ್ಟರ್ ಸುರೇಶ್ ಮತ್ತು ಅವರ ಪತ್ನಿ ಡಾಕ್ಟರ್ ಪ್ರೀತಾ ಹಾಗೂ ಡಾಕ್ಟರ್ ಸುರೇಶ್ ಕುಮಾರ್ ಅವರ ತಂಗಿ ಡಾಕ್ಟರ್ ವಿದ್ಯಾ ಹಾಗೂ ಅವರ ಪತಿ ಡಾಕ್ಟರ್ ಸಚಿನ್ ಅವರು ತಮ್ಮ ಅನುಭವಗಳನ್ನು ಇವತ್ತು ನಮ್ಮೊಂದಿಗೆ ಹಂಚಿಕೊಳ್ಳುತ್ತಿದ್ದಾರೆ. ಇವರಿಬ್ಬರೂ ನಮಗೆ ಬಹಳ ಆತ್ಮೀಯರು. ಡಾಕ್ಟರ್ ಸುರೇಶ್ ತುಂಬ ಕರುಣಾಜೀವಿಗಳು. ಎಂತಹ ಪರಿಸ್ಥಿತಿಯಲ್ಲೂ ಸಹಾಯಹಸ್ತವನ್ನು ಎಲ್ಲರಿಗೂ ಚಾಚುವಂಥ ಕರುಣಾಮಯಿ. ಡಾಕ್ಟರ್ ಸುರೇಶ್ ಅವರು ನಮ್ಮ ಸ್ನೇಹಿತರೆಂದು ಹೇಳಿಕೊಳ್ಳಲು ನನಗೆ ಬಹಳ ಹೆಮ್ಮೆ ಅನಿಸುತ್ತದೆ. ಈ ಡಾಕ್ಟರ್ಗಳ ಬಾಯಿಂದಲೇ ಕೇಳಿ ಅವರ ಅನುಭವದ ಮಾತುಗಳನ್ನು. ಎಲ್ಲರಿಗೂ ಧನ್ಯವಾದಗಳು. ಇಷ್ಟವಾದಲ್ಲಿ ಲೈಕ್, ಶೇರ್ ಮಾಡಿ, ಸಬ್ಸ್ಕ್ರೈಬ್ ಮಾಡುವುದನ್ನು ಮರೆಯಬೇಡಿ.
Since we run a polyclinic, we see that the dental patient come after the pediatrician patients will leave. So around 12 o'clock the doctor finishes, so then we enter with our patients, so that we are just few and we don't accumulate many people. It's just 1 or 2 patients per day, and then we are done for it. We fumigate the whole area and then it's only started the following day. I mean, we give a day gap and then work. We don't do continuous and mass practice. It's very selective and very elective practice right now due to the COVID time. I am Dr. Vidya and he is Dr. Sachin.
Tell me about your experience during COVID.
A standard operating procedure has been maintained in our clinic.
Volume.
We usually check up, we start off with our forms which are filled. We have a form which is filled. We check the temperature. And with this temperature, we fill this form and they enter. And oxygen saturation is done with the pulse oximeter. Over here, what you see. After that, when we know the oxygen saturation and the temperature is normal, we permit them inside our chambers for any protocol to be done and check out the radiological procedure or any other procedures which are not aerosol based. You didn't expect this. You need to goggle your mouth with this for 30 seconds. Okay? Twice. Okay? And then we will start off with the procedure. Okay? Please sir. Yes, you have to goggle in your oral cavity for 30 seconds. You can close your mouth and goggle now. After goggle one now.
And sit on the chair, remove the mask and sit on the chair. So we as a doctor also has to take a lot of precautions and protective gear. So what I am wearing is a PPE kit with one PPE kit, one N95 mask, a shield. I'm wearing a drape which is a plastic drape to protect the patient and us from any kind of spread of infection. So we are taking a lot of care because everything has to be autoclaved. Once the patient leaves the place, again we sterilize the whole place with the chair. Instruments have to go for sterilization, and then we look at the next patient. So this is a lot of things we have to do per patient, and it's very important to keep the clinic healthy and the patients in good condition. Anyway, you take care. Bye bye.
Where we do blood procedure.
No, it's okay.
When I'm working on the patient, I'll wear another glove. It will be double glove so that everything is safe.
Hello.
Hi Renuka,
Hi Vinayaka.
I am Dr. Suresh Kumar, pediatrician, Chinmaya Mission Hospital, and I also have my own clinic.
I'm Dr. Preetha, physician, same clinic.
So I was tested on 29th of July, positive for COVID-19, and since I had fever for only one day and I had joint pains, I just got a test done, and since all the healthcare professionals ಎಲ್ಲ ಹಾಸ್ಪಿಟಲ್ ಸಿಬ್ಬಂದಿಗಳು ಏನಾದರೂ ಸ್ವಲ್ಪ ಸಿಂಪ್ಟಮ್ಸ್ ಇದ್ದರೂ ಸಹ ಟೆಸ್ಟ್ ಮಾಡಬೇಕಂತ ಅದು ಒಂದು ಸ್ಟ್ಯಾಂಡರ್ಡ್ ಆಪರೇಟಿವ್ ಪ್ರೊಸೀಜರ್ ಇದೆ. ಸೊ ಅನ್ಫಾರ್ಚುನೇಟ್ಲಿ ಐ ಬಿಕೇಮ್ ಪಾಸಿಟಿವ್. Now, since it was a mild to moderate case and I did not have any symptoms after that, I was put on home quarantine. Home quarantine, the main advantages is that you can be at home itself and having homely food, and generally you feel that you are more under control of your situation compared to being in the hospital, where the entire hospital atmosphere itself is enough to create more fear in a person. Now, what is the positives of home quarantine is, one, you are very relaxed. Two, you can have homely food and with lot of support from the family. Now, when you can be home quarantined, one, you should be asymptomatic. Two, your saturation should always be more than 93%. Three, you should not have any breathlessness. ಉಸಿರಾಟಕ್ಕೆ ತೊಂದರೆ ಇರಬಾರ್ದು, ವಿಪರೀತ ಜ್ವರ ಇರಬಾರ್ದು, ಕಫ ಇರಬಾರ್ದು. ಸೊ ಇದು ಮೂರು ನಿಮಗೆ ಏನು ತೊಂದರೆ ಇಲ್ಲದ್ರೆ ನೀವು ಮನೇಲಿ ನೋಡ್ಕೊಂಡು absolutely nothing to do. And more than anything, it's a fear that causes more harm than the actual disease itself. Our body will behave the way our mind thinks. So if we get frightened, definitely the complications that arise from this particular disease is more often than if you're not frightened. So most important thing, of course, is by the grace of God and by everybody's social support, emotional support, and of course taking care by the wife. These are all very, very important, especially plays a very big role in your recovery in this particular disease. And she can tell.
Nothing. It is more important for the kids should be isolated from us. If at all I am positive, I should not be with them. That was my more tension than taking care of Suresh. So
luckily she was negative. And of course, children never had any problems at all. I never saw my children for almost 14 days. I was only doing video call.
they were on 2 weeks for first floor only. They never came down.
And of course, luckily my mother is in Australia. I never told her at all about this particular thing. Otherwise, she would take the next flight from Australia and come off over here. And my brother, of course, my brother offered a lot of support from there. Here, Vidya and Sachin, they brought all the necessary items for us every day, all the groceries, and all my friends, starting from Kaviraj, Mandy, Amar, Mohan, Vishi, Shankar, Harshad, then Gerald and Rajita, Arun and Sajita, then Dr. Bhagirath, then Sir and Madam from Mysore, and all my colleagues and friends from Chinna Mission Hospital. All of them used to call me up every day, and with all this sort of support, social support and this emotional support goes a long way in curing this particular disease. More important is that. And of course, I had a lot of time to take care, be at home, read all the books, starting from Sahitya Charitra, Ramayana, Mahabharata, and all other novels, which I had not touched for so many years. I used to work every day from morning 9 a.m. till night 12 midnight every day. First time in the past 20 years when I'm at home. So 14 ದಿವಸ ಮನೆವಾಸ, ಕೊನೆಗೆ ಕಾಯಕವೇ ಕೈಲಾಸ ಬಿಟ್ಟು ಮನೆಯೇ ಮಂತ್ರಾಲಯ ಆಯಿತು. So this is one lesson, or you will come to know that what you have to prioritize in life. What priorities is more now, you definitely will come to know only when you are affected something like this. And of course, everything we have to go by the grace of God itself only. Daiva Shakti idre ella naditade. With His divine blessings, we could get out of this whole thing safely without any problem. And finally, what I would like to say is, in this particular thing, social distancing, wearing masks, hand wash, and keeping yourself as far as possible at home is the most important thing to avoid this particular disease. I myself, with all the precautions which are taken, I still can't figure out from where I got it. It can be in the clinic, it can be in the hospital, it can be even when I go to buy some groceries, anywhere. So all I'd like to say is, all of you please stay safe, as far as possible stay at home, and if at all you go out, wear mask. And of course social distancing. Okay? Thank you very much.
Thank you.
Thank you.
And finally, a big thank you to Johnny and Madhavi for all the concern and support across the 7 seas. Thanks a lot, buddy, for being a pillar of strength and taking the time off, and in spite of your busy schedule, calling me every day. And I also thank all my hospital colleagues and Harshad and also Rajesh and Kali. Thank you.